Hello everybody. By now you've taken VM1 and you've had a couple months maybe to practice your VM1 techniques, and maybe your interest has peaked a little bit and now you're thinking about taking VM2. So I just want to explain a little bit about what you're going to learn in VM2. I'm recording this from the Bukhansan Forest just outside Seoul, South Korea. Beautiful national monument here. Very wonderful hikes all around this very busy city in Seoul. So in VM1 you learned how to feel what an organ felt like. You learned how to feel what the liver felt like, the gallbladder, the stomach, the colon, the small intestines, and you noticed that they all had a different personality to them. They felt a little different from one another. And you also learned how to do general listening and local listening, and you learned how to utilize inhibition in order to confirm the accuracy of your listening. So in VM2, what we're going to do is review all those techniques and organs you learned in VM1 for about a day or so, and we're going to explore more deeply into a few more different techniques with each one of those organs. And then, on top of that, we're going to learn how to expand your listening skills a little bit. What we're going to do is be learning how to listen at the level of the organ. For example, possibly the stomach may not be the only part of the restriction. It could be having a little bit of tension or a restriction or an adhesion with the spleen via the gastrosplenic ligament. Or, for example, the cecum. The cecum might have a line of tension that goes up to the right kidney via the fascia of Tolt. So in VM2 you're going to learn how to listen at the level of the organ in order to feel those connections. And then you're going to learn how to treat those two organs together. So it's a very exciting class. You'll really expand your listening skills. In addition to that, we'll be utilizing inhibition throughout the entire course. So by the end of the 4 days, you will be experts in local listening and in inhibition. And as well as that, we will also be learning how to work with some of the deeper structures in the abdominal cavity. For example, the kidneys and the spleen and the pancreas. The spleen, for example, may be having some problems with relationship. The patient might come to you and they may just be complaining of some left shoulder pain, or some problems with the left ribs. Or for example, the pancreas could be causing L1, L2 to be restricted. And the kidneys may be causing low back pain. So we'll be exploring all those possible connections. So I'll look forward to seeing you in VM2. Until then.